I am Dr. Stephen Martin, and I am the Chief Operating Officer of the Cook County Department of Public Health, the state-certified local public health department for suburban Cook County, excluding the city of Chicago, Evanston, Oak Park, Skokie, and Stickney Township. Our agency is part of the third largest public health system in the nation and works to protect and promote health and prevent illness, disability, and premature death among nearly 2.3 million community residents of the state of Illinois. By now, we all know many of the key facts. In suburban Cook County, obesity rates have risen dramatically over the past few decades, and the number of youth and adults who are obese is unacceptable. In suburban Cook County, almost 63% of adults are obese or overweight. Between 1998 and 2007, the number of adults that identified themselves as obese increased by nearly 10%. Moreover, only over 40% of third graders in Cook County were overweight or obese, taken in 2004. Our local communities, like the nation, the state of Illinois, are significantly impacted by the burden of chronic disease. There is no doubt that both overweight and obesity have contributed to the epidemic that has reached unacceptable proportions. It is clear that inaction is not an option. So what's the solution? As a key stakeholder in addressing the obesity epidemic and an expert in monitoring health status and effective health promotion strategies, we offer three important recommendations as part of the solution. First, a statewide comprehensive systematic initiative to collect and or report local data such as body mass index that goes beyond the state and county levels. Second, state level reforms that allow for a comprehensive coordinated approach in allocating resources and promoting effective strategies to address obesity and other chronic diseases. Third, integration of state certified local health departments as part of the statewide system to provide a leadership role in ensuring coordination of preventive strategies and services. First, a statewide comprehensive systematic initiative to collect and report local disease is needed. Local data beyond the state and the county levels is imperative because of the diversity and disparities between communities and neighborhoods at the local level. Collecting and having access to local level, real-time data will allow state-certified local health departments to prioritize and direct resources where they are needed. Second, state-level reforms is vital and requires leadership and coordination that cuts across departments and agencies. For example, there are multiple statewide task forces as well as several state departments that provide funding at the local levels to address chronic disease prevention, including but not limited to IDPH, IDHS, and IDHS. Unfortunately, the state's current approach and funding levels need to change and grow in proportion to the magnitude of the epidemic we are facing. Our last recommendation is to include the state-certified local public health departments as part of the overall state coordinated system in addressing the obesity epidemic and the burden of chronic disease. Obesity and physical activity continue to rank as priority health conditions across Illinois communities as identified in the health assessments, such as IPLAN. And we must focus on prevention and keeping Illinois healthy to make significant improvements in the health status of our residents. Thank you, and for the opportunity to present this testimony. It is written, it's a lot longer. I've submitted it, and I look forward to your questions.